So I'm just going to say I love that talk. And so this is what happens when you fail to find any kind of balance, I guess, or in the periods of time when you almost inevitably will fail to find balance, because it does come and go, as Dr. Rev has said, and most of us will feel at least somewhat burned out at some point in their careers. I don't have anything to disclose. Burnout has become very popular in the surgical literature in the last couple of years. It's quite easy to find articles about it if you look for them. I wasn't really exactly clear on what it was, and so these are the two definitions that come up over and over again. And you might recognize yourself, or you might recognize your friends. You almost certainly will recognize someone. So it's a syndrome of emotional exhaustion, depersonalization, where your patients or your family seem sort of less interesting, or you care about them less, decreased sense of accomplishment, you feel like a failure at work, a sense of disconnection with your coworkers and your patients, and I'll add your family and friends as well. You tend to have a lowered performance under these circumstances and a negative attitude toward yourself and to others. So those things aren't core to someone's personality. They're part of an illness or a syndrome. It's really studied as a science. It's most commonly used as the Maslach Burnout Inventory, which has been around since the 1970s and is pretty reliable, correlates with depression, and other sort of socially dysfunctional modes. And it's a long questionnaire, basically a three-dimensional description that includes questions about exhaustion, cynicism, and inefficacy. So what happens if you are burned out? You perform poorly at work. It impacts your decision-making and your performance. It decreases your work productivity. It can cause you to leave the workforce temporarily or permanently. And of course, it spills into your personal life with a litany of bad relationships, substance abuse, and health problems across the board, including complications of hypertension, headaches, anxiety, and sleep disturbances. So there really are no borders. When I did a lit search particularly for burnout in surgeons, the articles came from Canada, they came from Kenya, Argentina, Great Britain, pretty much every country that there are surgeons in. And it also crosses boundaries across all age, gender, all stage of career, certainly all areas of medicine, and honestly, probably all areas of everything. Kevin referred to the single mom working 3 shifts. You know, our assistants and secretaries get burned out, the flight attendants who helped you on the plane. My contractor right now is definitely burned out. So it's not just us. I would say that the definitive article for our field, or the definitive study, came out of an ACS-funded survey, which is sort of interesting, in 2008, and it was spearheaded by Dr. Buyske with a really good group of authors who then continued to mine that very wealthy information and write a whole series of articles. And they surveyed the college memberships of about 72,000. There were 25,000 who had email addresses that were acceptable. They got a 32% response rate, and there were probably another dozen articles after this original one that was presented at the ASA and published in the Annals on Burnout and Career Satisfaction among American Surgeons. And the short version is, we are prone to burnout, and depending on your source, anywhere from 28% to 40% or even more will have some period of burnout during their careers. So when is it that you're most at risk for it? It does tend to be predictably younger people who are either insecure in their work patterns, trying to figure out what to do, saying yes to everything, trying to raise a family. Other risk factors turned out to be a non-physician working spouse. Surprisingly, being married to another doctor was actually somewhat protective. Not sure I believe that, since I was married to another doctor for a while, but maybe not. The area of specialization can make you prone to burnout. Traumatologists are particularly prone in our field. Private practice is a little bit more prone to burnout than academic surgery. Having young children under 22, your youngest kid being under 22, puts you more at risk. Your youngest kid being over 22 is actually protective. The number of nights on call, and the critical number is more than 2 a week. The hours worked per week, and the critical number there fell at over 60. Most of us work in the vicinity of 60. And having a job that it really is a kill what you eat, with no recognition for any other kind of effort. Or eat what you kill, sorry. So how can we protect ourselves? Because that sounds like a lot of our jobs. And I'll start by saying, know that list and sort of pay attention to it, because you can actually prepare yourself and protect yourself against some of those situations. One of the best ways is to recognize when you start feeling burned out. And I was on the Milestones Committee, the group that developed one of the new training requirements from the ACGME and the ABMS, and I'm proud to say that we sort of included in one of the requirements of measurement of residents is their ability to recognize the maintenance of their own physical and emotional health and the competency of professionalism. So they're graded across the years, and this only went into effect last year, on their competency. So level 1, sort of minimally competent, what you might expect out of an intern is that they understand the principles of physician wellness and fatigue mitigation. And then we put in a couple of other more measurable rules too. Level 2, the more sophisticated, more experienced resident can monitor his or her own personal health and wellness and recognize problems in other people. And critically, that they can assure fitness for duty. And I'm going to say duty in the hospital and duty to your friends and family as well. The next level actually sets an example, is proactive about their healthy habits, and models appropriate management for personal health issues, including talking about them as appropriate, and also models fatigue and stress management. And the highest level, the one that we're all supposed to achieve before we finish training and then live with the rest of our life, is being proactive in changing your schedule, your work environment, intervening in other ways to make sure that people around them are maintaining their personal wellness, and making sure that their colleagues and themselves don't compromise patient safety. So I thought that was a big step forward in the culture of surgery, that we would actually put that into the assessment of residents, and hopefully over the next few decades that will pay off. So how can you protect yourself? And again, I think this is the sort of thing that's worth kind of putting on your refrigerator for a little while until you can internalize it. And so the people who feel best about it are the ones who can respond positively to the following statements. I find meaning in my work, which we should hopefully all be able to say, although your burnt out friends will tell you that they really don't care. They don't like it anymore. They wish they could do something else. They're sick of going to work. They don't like their patients. So finding meaning in your work, you protect time away from work, focus on things that are important, whatever they are, take vacations, have hobbies, and talk with people about how they're feeling. One of the offshoot studies included maintenance of physical health, and there was a direct correlation of lower rates of burnout among people who just plain keep up with their health care screening, see their doctor when they're supposed to. For women, get mammograms and pap smears when you're supposed to, prostate cancer screening, all the things, colonoscopy. People who actually meet those guidelines, it's sort of a surrogate for taking care of yourself. And also exercise. People who meet the CDC recommendations for 150 minutes a week of moderate exercise and some weight training actually have lower rates of burnout, which I think is intuitive. And somehow we all think that we're better than that or beyond that, or we don't have to fit in that mold. But it is pretty well supported that if you do, you'll do a little bit better. Much easier to prevent burnout than to try to cure it. Once you've got it, it's hard to get out of. Part of the illness itself is just not recognizing it or feeling like there is no solution to the problem. So prevention is better than cure. So how can you prevent it? You can really sort of make a list. Dr. Callery's talk, he said that you should make sure in your first job that you have a period of feedback and a period of reflection also. How are you doing from others' point of view? How are you doing yourself in your own job? So this is also a period of reflection. What is it that's important to you personally and professionally? Write them down. Write a list of the top 3 or top 5 in both categories. Rank them in order in both different categories. Then see where they conflict. Where is it that one is going to prevent the other? Figure out how to manage those conflicts, which is the highest priority and which are the lowest ones, and then do that again every couple of years. That's a very safe way of not just getting caught on the raft of your training and your work and keeping on flowing down the river. The other thing is to figure out what about your job you actually really like. Do you like the patient care part? Do you like the teaching part better? Do you enjoy administration? Not everybody does. Some people really do. Are you a researcher or are you not? We're all kind of trained, as Dr. Revis said, into the triple threat thing. Well, not everybody likes research. Not everybody in the end really likes patient care. So what are the parts that you really care about? Look at your job again. Reshape your job situation if the position that you're in right now isn't going to work for you. So in the end, my mom was really smart. She had it right down. She didn't need to survey 27,000 surgeons. It's just the basics. They didn't actually say get enough sleep, but I put that in line with identifying your own fatigue. She said get enough sleep, eat, exercise, spend time with your family, make sure you have interests, be part of your community, and take care of each other.